Good morning, this is Sangeeta. So here I have considered the case study as the healthcare management system, which plays a vital role in the life of the human. So here I have chosen the next gen healthcare as an sample case study. So here they have given like what were the challenges they have faced and what were the features they have incorporated in order to come out of it. So with the help of the technology partners and with the help of the techniques, so how they came out of the challenges. So this is most suitable for the course which I have chosen is like object oriented analysis and design, since every particular requirements which is collected from the customer needs to be satisfied in terms of an application, in terms of design, in terms of an implementation. So that is why I have chosen this next gen healthcare system. So getting into this, this next gen healthcare believes the healthcare provider is all about the patients and not about the technology. They want to keep their patients in most happiest manner. So that is their main motive. So they offer many things like EHR, which is electronic health records, and practice management system, which is most sufficient or supported system for the physicians. And the third thing, which is the population health management. So these are all the three factors they always used to key in and they used to focus on. So providing solutions is like empowering the physician success as well as enhancing the patient care. So they want to experiences these two different sectors, that is how the physician gets succeeded and how the patient care gets enhanced. So here they have faced the challenge like unable to evaluate the transition from one phase to the other, that is from patient care system to the physician supporting system. So they depend on the IT environment, where again it is a location based one and it is scattered all over the different locations. So managing all these resources was the hectic challenge for them. So they depend on one particular cloud platform, which is AWS. As we know, it is an Amazon Web Services. So they provided a platform to consolidate all their technology under one roof. So some of the business challenges they face is like unknown causes, which happens frequently or in the mid of the deployment of an application, and also maintenance as well as the hardware failures. Sometimes they used to face the challenges. So getting into the point like maintaining the patient health information as well as the patient identifiable information, these two terms which is called as PHI and PII. So they depend on the cloud partner in order to enhance their technology. Here they also focused on the security systems like DDoS protection, which is since it is distributed all over the path, and they used not only the technology which is supported based on the healthcare, they also use the computing, they use the database technology, they used analytics and the networking as well as the security. So the next gen, not just the technology partner of the domain, they want to have a specific transformation of the domain. So here they have came up with one particular solution which is called as the AWS, acts as a cloud partner for them in order to maintain all these challenges and what they want to build as a one particular system. So this is about the next gen. So here I have considered an application which happens in the real scenario of an hospital. So I have considered ABC Hospital. So here we could see many patients who are standing in a queue. So here they have wasting their time, and standing in a long queue degrades the customer. So all these things can be solved with the help of queue management system. So this could be varied as single queue management system as well as the multiple queue management system. So the main aim behind this is a patient before entering into the hospital can able to manage every information which happens in the hospital. So you can have a prior booking, you can have a prior consultation with the doctor. So the waiting time of a patient is going to be reduced. So this is what we could see an example of the multiple queue management system. So here we can see like A, B and C. So whenever the patient gets into the hospital, you could see what is the order in which he or she is served, whether the doctor is available or not, whether in which fashion he is going to visit the doctor. So this is the application behind that. Here is an admin or doctor panel which is supported with the exam server, and there is a display which is visualized to the every particular patient. So here the token generation is also completely personalized, and token generation is done on the payment of fees. Once the amount is paid, automatically the token is going to be generated, and what is the next turn for that particular patient will be displayed. So this is a simple queue management system where the patient does not need to wait for a long time. He or she knows the availability of the doctor and when they get into the consultation. So the main features of this queue management system is like it is provided through a web-based solution such that it is accessible in all the places, and this real-time queue management system also supports the most effective factor, which is the time management and the customer satisfaction, so which is most needed. And of course the multiple regions is focused not only on the one thing. The integration with the other softwares is also possible with the help of this QMS, such that it provides a better management of the hospital. So here you could see a patient who enters inside the hospital or the clinic is completely taken care without any hassle. So all these things is accessible through her tab or through her mobile through one integrated solution. By using this application, you could generalize or you could categorize on which sector he wants a consultation. So by feeding in the username and password, this is possible. So this is like interaction with the doctor. So before getting in touch with him, before getting in contact with him, so here we could see how the amount is paid, like how the claim is approved. So we can able to visualize the clinical workflow, we can able to visualize the billing workflow, and everything is going to be transparent system. So also here we can able to visualize the report template. What is the performance of a client? What is the performance of a performance factor of a client? So that is visualized. So again, this is one of the example which is provided by the AWS. So it takes the complete thing, like either it is a family, either it is an individual. So what are all these supports which can able to provide? So this is how this one integrated solution which providing the quality factor as the most thing. So this is the second example of the application, which is called as the Auto. So here we can able to book the virtual visits. So instead of getting into the hospital and looking for the doctor, waiting in a queue for a long time, so there we could able to come up with one solution called as the queue management system. So instead of that, even we could have an application which is called as the virtual visit. So this virtual visit will help the patients to stay at home. They can have the consultation with the doctor. So without entering into the hospital, they could able to get their illness cure. So that is what the main aim of this application. So this is going to support the patients as well as the doctors. So the doctor can give utmost care to the patient, and the patient can have the satisfied treatment given by the doctors. So the one thing is they have to pre-feed all the informations about them. They have to give in key in all the factors, like how what is a problem, what is the patient problem, and from where they are coming. So the one suggestion is this particular application is most feasible for the remote healthcare system or remote healthcare monitoring. So this is these are all the features where there's virtual visits. So here we could able to come across one particular patient, like this is what they have diagnosed the patient treatment. This is, so here there is a appointment with doctor. So here we could able to see the patient is getting the consultation from the doctor through the virtual manner. So whatever the problem they face is going to be recorded, that is, it is going to be diagnosed, and the prescription is also given in a virtual manner. So this avoids the unnecessary movement of the patient, such that it makes the effective management too. It focuses on the time management as well as the cost management. So here we could able to see the consultation which is given by the consultation which is given by the doctor. So everything is recorded with the help of the EHR. Suppose if I want to end the visit, end the consultation, here we could see the patient is provided consultation with the doctor. So this could be winded up with whether she wants to continue the visit or she wants to end this visit. So that could also be chosen with the help of the application. So the main objective is the remote form of managing this, the remote form of giving a consultation reduces the time as well as the cost and gives more satisfaction. So that is the main objective of this auto. So here this virtual visit is most beneficial in the case of a remote healthcare system where we could not deploy the hospitals or where we could not facilitate the doctors. So this virtual visit application is most helpful and beneficiary for the remote places as well as in the villages. The only thing is they need to access this application through a mobile or through the tab. So this can be provided through the healthcare region. So here we have covered the challenges which was faced by the next gen and what are all the solutions which they have came across through AWS and how the queue management system is done, and followed by that we have seen an example of the virtual visit which has taken in the hospital. So with this case study we could able to visualize the problems which is faced in a hospital and how it can be recovered. Thank you.